So this is a great question, and it came off of the video where I stitched a woman who was called with her biopsy results, and the results were relayed to her through a nurse in the clinic who gave her not only the diagnosis, but also a treatment plan. Now, I don't want this to be controversial because I know people do things different ways and there's no right or wrong, but I personally don't love the idea of having anyone other than the physician staff calling a patient with a diagnosis and treatment plan. I think it can be fine to have your nursing staff call a patient with a normal biopsy result or a biopsy result that is benign, that doesn't require further future intervention. But especially when the biopsy is something that was unexpected and it requires a treatment plan, a prescription medication, I think it's important that someone discusses this with the patient so that they understand. Because as you see in this video, that if you click the comment, it will go back, this patient didn't understand. And then she went to Google and things got crazy. So I think it's really important when you call a patient with a diagnosis that you do a few different things. The first thing is that you relay to the patient what you think the diagnosis is and why you think that. So if you're calling with a biopsy result, you will say that based off of your biopsy results, we believe that this is the diagnosis you have. The treatment for this is this, and what you can expect from that treatment is this. And then the final thing you want to tell the patient is when they should follow up with you. One of the things I see all too often in my area is that patients are called with a diagnosis. Sometimes it's even just left on their voicemail with none of that information. There's no discussion with the patient what that means. There's no discussion with the patient why they need that particular medication, what the expectation is for treatment length and outcome, and when their next follow-up should be. So you always want things to be clear for your patients. You want them to understand their diagnosis, understand the treatment, why it's given, and then also what the expectations are moving forward. So hopefully that's helpful, but again, I think it's very important if there is a diagnosis that you are calling the patient with that is unexpected, life-changing or life-altering, like a cancer, or something that has a treatment plan. I think it's really important for the person caring for the patient to be the one calling them, like the physician, nurse practitioner, or PA.